Hello and welcome to Laser Lessons from Dr. Phil. This is Dr. Phil Harrington. My topic is care for acute and sports injuries, less rice and more laser. I welcome your comments on this video or shoot me an email at laserlessonsfromdrphil@gmail.com. This webinar will present information on acute and sports injuries, review studies on the use of laser therapy for acute injuries, and give clinical recommendations for the treatment of acute injuries. An acute injury is typically the result of a single traumatic event, and that twisting, tearing, or blunt force trauma leads to the microscopic damage of small blood vessels and connective tissues. That microscopic damage also results in blood, plasma, and cellular fluid leaking into nearby tissues. The leaking of fluid, along with the collection of chemical mediators and dilation of blood vessels, causes acute injury swelling. As the blood migrates towards the skin surface, the skin may appear dark red or have that characteristic black and blue appearance of bruising. The sensation of pain is a result of the fluid collection, certain chemicals released in the body as a result of cellular injury, along with lowered oxygen levels in the soft tissues, also known as hypoxia. In our clinics, the acute injuries that we see are ligament sprains, muscle and tendon strains, knee injuries, slips and falls, sports injuries, and motor vehicle accidents. Now, in the past, why did we use ice on those injuries? And I can remember being taught in my physical therapy modalities classes at Palmer College of Chiropractic, they taught us that ice was used to decrease pain, swelling, and inflammation, resolve spasms, reduce soreness, and it was best used after exercise or after a pain-producing activity. So anytime an athlete would perform in workouts or practice or a sporting event, they were told to put ice on it immediately afterwards. And the ways that we used ice included these. When we apply ice to the tissues, of course that numbs the skin. It may decrease inflammation, but it also decreases circulation and decreases metabolic activity. And the question would be, does that help with healing? A little historical view. Until 2 centuries ago, ice was just an unfortunate side effect of winter. But in the early 1800s, one man saw dollar signs in frozen ponds. Frederick Tudor not only introduced the world to cold glasses of water on hot summer days, he created a thirst people never realized they had. And then, a doctor by the name of John Gorey was granted the first U.S. patent for mechanical refrigeration in 1851, and it was for his invention of the first ice machine back in 1845. Dr. Gorey is considered the father of air conditioning and mechanical refrigeration, although he was ridiculed during his lifetime. Going back even further, we have various medical uses of cold and ice. The use of cold as a therapeutic agent has a long and colorful history. The Edwin Smith Papyrus, which is the most ancient medical text known, it's dated about 3500 BC, made numerous references to the use of cold as therapy. During any kind of trauma, cold was used to treat inflammation. In 400 BC, Hippocrates used cold to treat swelling and pain. In 1050 AD, Anglo-Saxon monks used cold as a local anesthetic. Baron de Larrey, a French army surgeon during Napoleon's Russian campaign, packed the limbs in ice prior to amputations to render the procedures painless. And at the right we see Dr. Temple Fay, the head of the neurosurgery department at Philadelphia's Temple University, and that was in the 1930s. Dr. Fay is credited by many as having introduced hypothermia, both whole body and localized, to modern day medical practice. His interest in hypothermia as a therapeutic measure began in 1919 when, as a sophomore in medical school, he was asked by a professor why cancerous metastases were seldom found below the knees and the elbows. Interesting question. In the 1940s, the Germans obtained a copy of Fay's manuscript detailing his experience with hypothermia. For the proposed purpose of searching for new ways to help German airmen survive when shot down and stranded in the cold open North Sea, Nazi scientists used concentration camp prisoners in a series of infamous hypothermia experiments that were conducted oftentimes with an intentional endpoint of death. In the early 20th century, as a neurosurgeon, Temple Fay pioneered human refrigeration as a treatment for malignancies and head injuries. Now, here I'd like to discuss a little bit of the passage of time, and what we're going to talk about is the Rice Protocol. We're going to spend a few slides talking about that Rice Protocol, which is the acronym coined in 1978 by Dr. Gabe Merkin in his sports medicine book. Of course, RICE, as we all know, stands for rest, ice, compression, and elevation to represent the 4 activities for treating acute athletic injuries. The RICE protocol has been ingrained in academic curricula as well as in public perception for over 4 decades. And as a slightly humorous way to look at the passage of 4 decades, there you see the Rolling Stones on the left in 1978 when Dr. Merkin coined the term, and then in 2021, the Stones. Now, if you are a Stones fan, of course you know that in August of 21, drummer Charlie Watts did pass away, but hopefully you get my point here with the passage of time and the length of time that the Rice Protocol has been ingrained in therapeutic curricula. In 1978, Dr. Merkin released the sports medicine book. He coined the acronym RICE, standing for rest, ice, compression, and elevation, to represent the 4 activities for treating acute athletic injuries. Today, if you look at various online resources, one would be to look at the Harvard Medical School website and do a search for treating sports injuries. Now, the Harvard Medical School, they add protection as the first activity after an acute injury to make the acronym PRICE instead of RICE. And then at the bottom, they list the use of ice as a way to manage many injuries. If you go to the preeminent doctor in the world, and for those of you practicing clinicians now, I empathize with you and the fact that your patients may be searching and believing Dr. Google before they would believe you. So I understand sometimes the uphill road you have to climb. But if you do go to Google, what does Google say for acute injury treatment? There you see it listed: rest, ice, compression, and elevation. Now, to continue with my classic rock theme here, starting out with the Rolling Stones, I will continue with Foreigner and to borrow some of their lyrics from one of my favorite Foreigner songs. You're as cold as ice, you're willing to sacrifice our love, you'll never take advice. Someday you'll pay the price, I know. But my point that I'm trying to establish during this webinar is that if you are using ice on acute injuries, you are possibly sacrificing the patient's healing. Again, in 1978, Dr. Merkin coined the term RICE. As it says from his website, drmerkin.com, he now has an article that he wrote in September of 2015, Why Ice Delays Recovery. And he says, Dr. Merkin says, when I wrote my best-selling book, I coined the term RICE for the treatment of athletic injuries. Ice has been a standard treatment for injuries and sore muscles because it helps to relieve pain caused by injured tissue. Coaches have used my RICE guideline for decades, but now it appears that both ice and complete rest may delay healing instead of helping. In a recent study, athletes were told to exercise so intensely that they developed severe muscle damage that caused extensive muscle soreness. Although cooling delayed swelling, it did not hasten recovery from this muscle damage. A summary of 22 scientific articles found almost no evidence that ice and compression hastened healing over the use of compression alone, although ice plus exercise may marginally help to heal ankle sprains. That is direct quotes from Dr. Merkin's article, Why Ice Delays Recovery, that you can find on his website at drmerkin.com. We have to understand that healing requires inflammation. When you damage tissue through trauma or develop muscle soreness by exercising very intensely, you heal by using your immunity, the same biological mechanisms that you use to kill germs. That's called inflammation. When germs get into your body, your immunity sends cells and proteins into the affected area to kill the germs. When muscles and other tissues are damaged, your immunity sends the same inflammatory cells to the damaged tissue to promote healing. The response to both infection and tissue damage is the same. Inflammatory cells rush to injured tissue to start the healing process. The inflammatory cells, called macrophages, release a hormone called insulin-like growth factor, or IGF-1, into the damaged tissues, which helps muscles and other injured parts to heal. However, applying ice to reduce swelling actually delays healing by preventing the body from releasing IGF-1. And Dr. Merkin in his article will go on to say that anything that reduces inflammation also delays healing. And that's going to include not only ice, but cortisone-type drugs, any pain-relieving medications such as non-steroidal anti-inflammatory drugs like ibuprofen, immune suppressants, again, cold packs or ice, and anything else that blocks the immune response to injury. The immune response to injury is so important. There are also studies that indicate that ice also reduces strength, reduces speed, reduces endurance, and reduces coordination. What does Dr. Merkin recommend? He says, if you are injured, stop exercising immediately. If the pain is severe, if you are unable to move, or if you are confused or lose even momentary consciousness, you should be checked to see if you require emergency medical attention. Open wounds should be cleaned and checked. If possible, elevate the injured part to use gravity to help minimize swelling. A person experienced in treating sports injuries should determine that no bones are broken and that movement will not increase damage. If the injury is limited to muscles or other soft tissue, a doctor, trainer, or coach may apply a compression bandage. Since applying ice to an injury has been shown to reduce pain, it is acceptable to cool an injured part for short periods soon after the injury occurs. You could apply the ice for up to 10 minutes and remove it for 20 minutes. But there's no reason to apply ice more than 6 hours after you have injured yourself. So again, from the time of injury, there is no reason to be applying ice more than 6 hours after the injury. So now we will look at several studies, and when I cover studies in my presentations, I realize it's difficult to read all of it. I'm just sharing these with you, and we will run through these fairly quickly. You can always scroll back in the video if you find a study that is of particular interest to you, and you can do your own research and find it. But here we go. In this study from the Journal of Athletic Training, does cryotherapy improve outcomes with soft tissue injury? And I always use red arrows to draw your attention. In comparison with other rehabilitation techniques, the efficacy of cryotherapy has been questioned. The exact effect of cryotherapy on more frequently treated acute injuries has not been fully elucidated. Additionally, the low methodologic quality of the available evidence is of concern. So again, drawing some question into whether cryotherapy does even improve outcomes with soft tissue injury. This study indicates these data suggest that topical cooling, a commonly used clinical intervention, seems to not improve but rather delay recovery from eccentric exercise-induced muscle damage. From the Sport Journal, the Rice Protocol is a myth, a review and recommendations. I believe this is an open access paper that you can find on the internet from the author Dominic Scioglia. Eventually, the general public was quickly accepting the notion that any injury should be treated with the application of ice, regardless of its severity or how it occurred. So in this article, they go through the interesting history of the use of ice. And in this case, it was a young man who suffered a severed arm after jumping from a freight train, and they packed the severed arm in ice to preserve it. Continuing from this article, the inadequate functioning of the lymphatic system is the primary contributor to the accumulation of waste products, excess swelling, and the inability to allow for the optimal recovery of damaged tissues. And one of the foremost experts on not using ice on acute injuries, Mr. Gary Reinl, says there's not too much inflammation. The problem is there's too little evacuation. So we always think of the sprained ankle and how that swelling occurs in the area of the ankle joint. And the problem is not that there's too much fluid going into the area, but rather that there's too little fluid getting out. Conclusions of this article. In addition, the application of ice has been found to not only delay recovery, but to also damage tissue in the process. The evidence suggests that the application of ice is only necessary if pain reduction is the desired outcome. And again, Dr. Merkin indicates that from the time of acute injury, after 6 hours, there is no need to be applying ice 6 hours after injury. Another article on the topic, is ice right? Does cryotherapy improve outcome for acute soft tissue injury? And this article coming to us from the University Hospital Galway in Galway, Ireland, they conclude there is insufficient evidence to suggest that cryotherapy improves clinical outcome in the management of soft tissue injuries. Now, what is the alternative? Many are suggesting that this should be used as an alternative rather than rice. We should use the acronym MEAT for movement, exercise, analgesics, and treatment. But this is a presentation on laser therapy, so let's examine how laser therapy can potentially help acute injuries. Laser therapy, or photobiomodulation, is the mechanism by which non-ionizing optical radiation of red or near-infrared is absorbed by endogenous chromophores to elicit photophysical and photochemical events at various biological scales without eliciting thermal damage. So the beauty is we are shining red and infrared laser light on the tissues, which is able to penetrate into the tissues and be absorbed by various chromophores in the tissues to help enhance the healing process. Unfortunately, in the history of laser therapy, there have been dozens of terms used to describe this therapeutic procedure. And skeptics of laser therapy would indicate that if we cannot even agree on what we're going to call it, Why should they give us any credence or any credibility? So thankfully, we now have the term photobiomodulation to describe this therapeutic procedure. But then, of course, in everyday terminology, you could think of it as a nickname. We call it laser therapy. An important point to remember is that this gentleman, Dr. Glenn Calderhead, introduced the term low-level laser therapy into the medical scientific literature in 1988. And at that time, Dr. Calderhead was working with surgical lasers, and when he would perform a surgical procedure on tissue, off to the sides of that surgical cut, he noted that the tissues actually looked healthier. So where the laser was performing the surgery, he called that high-level laser therapy, and then off to the side, he called that low-level laser. So the important point that I want to make is that when he coined the term low-level laser therapy, it referred to the reaction at the tissue and not the output power of the laser device. I say that because many, if not most, of the therapeutic lasers being used in healthcare today are Class 4 therapeutic lasers. What's happening when we apply laser therapy? In general, we are improving microcirculation in the tissues. We are increasing the delivery of oxygen to the tissues, increasing tissue oxygenation, and by stimulating various enzymes in the cells and in the mitochondria, we are helping the cells to produce more energy. The net physiological effects of laser therapy treatments are pain reduction, inflammation resolution, and accelerated tissue healing. So when we talk about the use of laser therapy with acute injuries, this is a paper I just really like to reference. When they ask the question, photobiomodulation, are we inhibiting or resolving the inflammatory process? So we all know that the non-steroidal anti-inflammatory drugs block certain COX enzymes to interfere with the inflammatory process in the tissues, and of course that interferes with healing, as Dr. Merkin indicated earlier. If the inflammatory process is an essential reaction for survival, why do we often use anti-inflammatory drugs and therapies? This paper asks. Well, we would use it to relieve short-term suffering and especially pain, but however, the inhibiting of that inflammatory process is not the same as resolving the inflammation. So inhibiting means that we are stopping the process, we're stopping that activity at a certain level in the steps of the inflammatory process. Whereas resolving means that we are assisting and helping this normal and natural process of inflammation proceed to its logical and healthy end. Now, here they indicate that both NSAIDs and ice inhibit the inflammatory process, whereas laser therapy or photobiomodulation resolves the inflammatory process. Photobiomodulation can act as a therapy resolving inflammation and is not inhibiting the process, which is a huge difference. Photobiomodulation significantly preserved mechanical behavior of inflamed tendons, whereas NSAIDs did not, and photobiomodulation significantly accelerated tendon healing, whereas various steroids did not. So a few more scientific papers looking at the use of laser therapy in animal studies. Here we're looking at the use of laser and cryotherapy for Achilles tendinopathy in rats. Our results demonstrate that cryotherapy in combination with laser can produce anti-inflammatory add-on effect. The order of therapy administration seems essential, as superior histology and biochemical results were found in the ice first, laser second group. So If someone is going to use ice on an injury, again, it should be used within that 6-hour window. And if you're going to use ice and laser together, you would use ice first and then laser second. In this study, they give you the parameters used for the laser and cryotherapy. And here we see the outcome. In the upper left is the control group, which the animals did not undergo any type of procedure. And then in the lower right is the group that underwent tendon trauma, followed by 20 minutes of cryotherapy or ice, and then followed by laser therapy treatment 1 hour after injury. And so let me emphasize again, if you are going to use ice on acute injury, use it within that 6-hour window. In this study, they're doing it within 1 hour. And you can notice that group 1 and group 6, virtually identical. Our results demonstrate that cryotherapy in combination with laser can produce an anti-inflammatory add-on effect. The order seems essential: ice first, laser second. Let's think about this for a moment. The benefits that we are getting with our laser therapy treatments is to improve microcirculation in the tissues. So, putting ice in there will reduce the circulation, and then by applying laser, we are improving the circulation. Notice that bottom arrow, if they did laser first and then ice, that displayed the poorest outcome. So when you apply the laser, you are improving circulation. If you come along and use ice after the laser, you will get bad outcomes. So just to emphasize, if you're going to put ice on an acute injury, ice first and then laser. We are seeing more and more trainers of professional and college sports teams using laser instead of ice, and it's encouraging. I had a Major League Baseball head trainer comment to me recently that we're using ice a lot less now, only the older guys that came up using ice, 2 players on the whole team. The rest of them, when they get acute injuries, they come in and they want laser therapy. So a few more studies to indicate here the effectiveness of photobiomodulation versus ice for skeletal muscle recovery. And in this one, they show that there is grade B evidence to support the use of photobiomodulation over cryotherapy for more effective post-exercise recovery of skeletal muscle performance. In other words, it is superior after activity, superior to apply laser instead of ice. A small animal study looking at the use of laser applied prior to muscle injury. And here they found that laser applied immediately prior to injury had positive effects during the muscle regeneration process. So there are indications that laser therapy treatments can actually help to precondition the tissues therapeutically before practice or an athletic event. This study indicating or looking at the different therapy regimes on the process of tissue repair in partial lesion calcaneal tendon, the conclusion: laser therapy was effective in improvement of collagen fibers organization of the calcaneal tendon after undergoing a partial lesion. Laser therapy on tissue repair, another one indicating that laser stimulated collagen 1 proliferation, improving the injured Achilles tendon healing process. So the indication is showing more and more and more that with any acute injury, apply laser immediately after that acute injury. This study examined the ischemia reperfusion injury that happens in certain types of injuries. When the blood flow is cut off, that is ischemia. When the blood flow is allowed to return, that's reperfusion. Ischemia reperfusion injury is by its nature, a pro-inflammatory event, but This indicates the modulatory ability. That's why it's, the term photobiomodulation is so good, because in this case, laser therapy attenuates the acute lung inflammation. It favors production of interleukin-10, which is an anti-inflammatory cytokine, while at the same time decreasing the amount of tumor necrosis factor, reducing tumor necrosis factor, which is a group of cytokines that cause programmed cell death. So again, applying laser therapy immediately after this type of injury. Another one looking at crush injury in rat sciatic nerve, simply stating that laser therapy should be started as soon as possible after peripheral nerve injury. Looking at human patients, laser therapy for sports injuries. Laser is an effective treatment for sports injuries, particularly jumper's knee, tennis elbow, and Achilles tendonitis. So I've shared with you numerous studies to indicate that both, laser therapy should be used on acute injuries as soon as possible afterwards, because it is going to help with pain resolution and healing of those damaged tissues. Now, sometimes people will ask about class 4 therapeutic laser on acute injuries, and they ask the question, well, what about tissue heating? Everyone knows that you do not put heat on an acute injury. And if you have any experience with a class 4 therapy laser, you know that it's possible that with some of the treatments there may be a mild elevation of tissue temperature. The important point to note is that for acute injuries, using the proper settings, which would be proper power and dosage and treatment delivery technique, there is no tissue heating. So we're using lower power. We are using pulsing frequencies to allow for cooling of the tissues. And so when we use laser therapy on acute injuries, even the class 4 therapeutic lasers, there is no tissue heating. So why do we use class 4 laser therapy for our photobiomodulation treatments? The treatments are safe and non-invasive with no side effects. They are effective for superficial wounds and deep neurological conditions. Patients love the treatments. It's an in-clinic service. And yes, we should use it as soon as possible on acute injuries. So there you have it. I've shared some information about acute and sports injuries, studies on the use of laser therapies for acute injuries, and I've given you some clinical recommendations for the treatment of acute injuries. My name is Dr. Phil Harrington. This has been Laser for Acute and Sports Injuries. Less rice and more laser. Thanks so much for being with me. I welcome your comments on the video, or send me an email at laserlessonsfromdrphil@gmail.com.